Good afternoon. Good afternoon to all. Prime Minister Lee Hsien Loong has just outlined our strategy over the next few months in the battle against COVID-19. With the support of all Singaporeans, we have made progress in rolling out vaccination program, expanding our testing capacity, and enhance our contact tracing capability. But the next few months will be critical. We are in a race with the virus. The virus will attempt to spread wider and faster, and therefore we need to do more and do faster too in vaccination, testing, and contact tracing. Minister Ong Ye Kung will talk about accelerating vaccination and expanding testing capacity, while Minister Chan Chun Sing will focus specifically on vaccination for the education sector. Overall, the COVID-19 situation remains extremely fluid. Malaysia has just announced that they will be implementing a full movement control order, phase 1, for 2 weeks, starting from tomorrow. We are working with Malaysia to ensure the continued flow of essential supplies between our two countries. I visited FairPrice and YCH over the weekend to better understand the measures that have been put in place to ensure that there is sufficient food and essential supplies for all. We have been working closely with the relevant agencies and companies to build up our existing stock, further diversify our sources of food and essential items, while also increasing local production. I want to assure everyone that we have ample supply of food and essential items. But please remember to only buy what you need. Our economic agencies are also working with companies, especially those dealing with essential goods and services, to minimize disruption to their supply lines. As the pandemic continues to evolve globally, we must remain prepared and vigilant as a nation while staying flexible and adaptable. It has been 2 weeks since Phase 2 heightened alert. The overall impact on Singapore's GDP is expected to be modest. The impact of the measures will differ across different sectors. Domestic consumer-oriented sectors such as food and beverage services, retail, and land transport will see a greater impact. On the other hand, the impact of these measures on outward-oriented sectors of the economy, such as manufacturing and finance and insurance, is likely to be less severe. Last Friday, Minister Lawrence Wong announced various support measures for business segments that have been significantly affected by these measures. MTI and the economic agencies are reaching out to the various companies as well as the trade associations to continue to work with them and to continue to monitor the situation. Even as we do our best to manage the situation at hand, MTI will continue to give businesses our full support to help them transform and seize new opportunities when they arise. And now let me say a few words in Mandarin. 大家下午好。刚才李总理在讲话中特别关心到我们当中的年长者，鼓励年长者尽早接种疫苗。他宣布说，凡是60岁或以上的年长者呢，还没有接种疫苗的，可以直接到接种中心接受接种疫苗，不需要预约。所以希望我们的年长者能够尽早接种疫苗，保护自己。Now I would like to hand over to Minister Ong Ye Kung, who will talk about vaccination and testing.
Thank you, Kim Yong. Thank you, Kim Yong, and hello everybody. It's been slightly over 2 weeks since we started the Phase 2 heightened alert posture on the 16th of May, so that is slightly over one infection cycle. MOH has been monitoring the data and the epidemic situation in Singapore, so let me give some updates on how well we have been doing under this phase. So let me share with you some insights by dividing the past 14 days into 2 halves. The first 7 days, which is 17th to 23rd May, and then the next 7 days, which is 24th to 30th May. Top line numbers, First 7 days, we have 182 cases. The next 7 days, we have 136 cases. So the number of infections have fallen by some. Each day's number, when we read the papers, the daily numbers, it can actually be broken down into 3 subsets. The first is those who are linked to a cluster and already quarantined. This group, we are not very worried because they are quarantined. They were in quarantine when they were discovered, they were detected, which means there was no chance for them to move around and infect others. Next group is those who are linked to a cluster but not quarantined. So for example, when we did special ops for Westgate and Jam, we tested many people who visited the malls and then they were infected, but they were not quarantined. It could be because they didn't come into very close contact with an infected person, but it was enough to get infected. So this is a group slightly more worried, but they are linked. Finally, the third group, the unlinked. And this is the most worrying group because unlinked cases means they are quietly transmitting the virus in the community. And the fewer there are unlinked cases, the better. So for the first 7 days, I talked about 57% of all cases are linked and quarantined. This is the group we least worried about. 21% are linked but not quarantined, and 22% are unlinked. So 57, 21, 22, in descending order of worry. For the last 7 days, the breakdown is 57, 25, 18. So unlinked cases have come down from 22% of all cases to 18%. In absolute numbers, it has also fallen 39 to 25. So the more we can shift this number away to linked cases, or better still, linked and quarantined cases, the lesser will be the spread of the disease, and the more we can bring the overall number down and suppress this wave of transmission. In addition to this, there are a few encouraging signs with how we are handling the current wave. One is close to 70% of all linked new cases every day are due to household transmissions. I mean, they are transmitted within the households and not out in the community. And for those who are transmitted in the community, they are not due to dramatic movements like parties or whatever, but usually the movement patterns are quite mundane. Home, work, tapao food, grocery shopping, and so on. And thirdly, other than the Gem Westgate cluster, there were no major transmission settings over the last 10 days. So all in all, we are nudging in the right direction, but just nudging, and controlling the situation. And we are constantly improving our contact tracing and quarantine protocols. But this wave of infection is not over, and we must continue to stay alert and vigilant in order to suppress it further. And one major strategy to do so is testing, which the Prime Minister just spoke about in his broadcast. Because testing is essential for us to quickly detect and isolate those who have been infected. When we detect a cluster, we carry out mass surveillance testing of persons with possible exposure to the infected cases. And in the past month, we conducted close to 40 special operations across the island, targeting housing blocks, supermarkets, malls, the seaport, the airport, so on, schools as well. So in the second half of May, we conducted on average 55,000 PCR tests a day, or more than PCR and ART tests a day. Let me repeat that. So in the second half of May, we conducted on average over 55,000 PCR and ART tests per day. Or that translates into more than 76,500 individuals tested per day. And we will continue to step up the number of tests. And one change that we are implementing is what the Prime Minister spoke about, fast and easy test strategy. So moving forward, we will extensively roll out fast and easy tests, and that will complement our current PCR tests. And there are different types of fast and easy tests, each with their own pros and cons. One that we are familiar with is the ART, antigen rapid test. It takes about half an hour. Involve swabbing that is not so difficult, just around the nostrils. Costs as low as $10 per test. Deployment is very flexible because it's a handheld device and can be en masse with many people swabbing at the same time. So we have rolled out ART to almost all our public health preparedness clinics that is providing the swab and send home service. All our polytechnics, and we want to expand the capacity shortly and deploy them also to private GPs. We are also exploring self-test ART, and you can purchase them in pharmacies and perform the test at home by yourself. So it works almost like a pregnancy test kit. And you can do so before you go to work, and that way it is even more flexible in terms of deployment. Thirdly are the breathalyzer tests. Now, two kits developed by NUS and NTU respectively have received in-principle approval by MOH and the Health Services Authority. The test takes a minute, no swabbing, you just blow into a mouthpiece or into a cartridge. And so turnaround time is fast, so it's very fast and easier to test than ART, but it involves some equipment. Yeah. And so it's not as deployable as the ART, which is very agile. So depend on the cost, the flexibility, the throughput, the turnaround time, we will deploy the most suitable test for the right settings. A few pilots are ongoing or about to commence. For example, ART has been deployed at PSA and also selected dormitories for foreign workers, and over and above the current rostered routine testing. The Causeway and the airport have adopted breathalyzers. So in the coming days or coming couple of weeks, we will implement many more pilots using fast and easy test kits for certain group of workers, for certain premises, for certain events. So group of workers, they can be cleaners, they can be F&B workers, frontline workers. For premises, we can look at, for example, hostels in universities, we can look at hospitals, we can look at malls. And for events, we can look at, say, weddings, or conferences, or religious gatherings. All this will be rolled out and then spread to even more users. Next, I'd like to talk about our vaccination program. We have just crossed 4 million doses mark. In all, over 2.2 million individuals in our population have been vaccinated with at least the first dose of COVID-19 vaccine. Vaccine reduces the chance of being infected and, more importantly, reduces the chance of being severely ill if you are infected with COVID-19. I've given some data earlier about our local experience. Let me give an update today. Of all local COVID-19 cases since the 11th of April, 8% of unvaccinated individuals develop serious disease, requiring supplemental oxygen. Amongst the vaccinated, the number is 1 out of 93 with severe illness requiring supplemental oxygen. So that is slightly over 1%, and that patient was ill even before infection. So this is not a full-scale empirical study, but as more data become available, the benefits of vaccination becomes clearer in terms of protection for the individual. Prime Minister outlined how we will boost our vaccination program in the next couple of months. Chun Sing will be talking about the exercise for the 400,000 students in a short while. Beyond that, we can now be more inclusive in administering vaccinations. Since the start of the vaccination exercise, a few subgroups have not been included. mostly because of medical reasons. The Expert Committee on COVID-19 Vaccination, our EC19V, they have reviewed the global and local data relating to these subgroups and is satisfied that vaccination is safe and efficacious for many of these subgroups. Who are they? Number 1, pregnant women. Number 2, breastfeeding women. Number 3, cancer patients on treatment, but before they receive their vaccinations, they ought to consult their doctors and receive the vaccination in a hospital setting. Number 4, persons with severe cutaneous adverse reactions. The current restrictions for these subgroups will be lifted from 4th of June 2021. So based on the rollout schedule for the various groups, if you belong to this subgroup and your age group the turn for your age group has started, you may register for vaccinations. Last important point on vaccination, very important point, is that the expert committee is also examining the data and reviewing the current policy where we restrict individuals with known anaphylaxis to take the vaccine. Specifically, the committee is reviewing the restriction for those who are not allergic to the mRNA vaccine or its components, but other substances like seafood, painkiller, antibiotics. The review will take about 2 weeks with the intention of removing these restrictions and allowing more individuals in this group to be eligible for vaccination. And this is quite a sizable group of over 30,000 individuals. So the lifting of these restrictions will be a fairly meaningful one. Director for Medical Services, Associate Professor Kenneth Mark will speak more about this in a short while. Finally, I want to talk about the special access route. MOH has authorized 2 vaccines, as everyone knows, the Pfizer-BioNTech vaccine and the Moderna vaccine. And these 2 vaccines are also used in our national vaccination program. And they are vaccines used in other countries, but either there have been no applications to use those vaccines in Singapore, or the application is outstanding with data still pending. These vaccines can be useful for individuals who are unable to take the Pfizer-BioNTech vaccine or the Moderna vaccine due to medical reasons. As I mentioned earlier, it's not a small group, over 30,000 individuals. So the review by the expert committee to allow more people with a history of anaphylaxis to take these 2 mRNA vaccines will address a large part of the current concern. Nevertheless, to provide more flexibility, HSA will open up the special access routes under the Therapeutic Products Regulations. And this is an existing avenue to import and supply unregistered medicines to address medical needs in unique or special circumstances. And this is for a limited duration and only during a pandemic. Under this route, HSA will take reference the vaccines that the World Health Organization approved to include in its EUL, or Emergency Use List. Once a vaccine is included in the EUL, a private licensed healthcare institution can bring it in to administer to individuals in Singapore. The vaccines currently under the EUL includes Pfizer-BioNTech, Moderna, Johnson & Johnson, AstraZeneca, and Sinopharm. As and when the WHO approves the Sinovac vaccine into its emergency use list, a licensed healthcare institution can apply to MOH to draw on our existing stock of 200,000 doses to administer to those who wish to have it. Now let me hand over the floor to DMS Kenneth Mark.
Thank you very much, Minister. To now, we've had the vaccination program going on quite smoothly, and Minister has announced that we've vaccinated just over 4 million doses being given out, and a total number of persons vaccinated being over 2.2 million. This is nearly 40% of our population. Our vaccination centers make good progress in vaccinating eligible Singaporeans since we started at the end of December 2020, and about 73% of the elderly over 60 years of age have booked their appointments or received their vaccinations. The majority of frontline workers have also received their vaccinations. Amongst eligible healthcare workers, more than 87% have booked or received their vaccinations. And the proportion of essential workers in other sectors receiving their vaccinations is also high. We've been working closely with the Health Sciences Authority and the Expert Committee on COVID-19 vaccination to review the eligibility criteria for vaccinations. And I'm pleased to share that MOH is satisfied that the COVID-19 vaccinations are safe and efficacious for more people with health needs. And we are issuing an updated guidance today, which allows vaccinations to be given to the categories that Minister Ong has mentioned. And in particular, patients who had previously experienced severe cutaneous adverse reactions or severe skin allergic reactions to medications other than the mRNA vaccines or components of those vaccines can now receive vaccination. And this will include specific medical conditions like Stevens-Johnson syndrome, toxic epidermal necrolysis. These are very severe reactions that occur as a result of taking various types of medications. And if you had previously had such a severe allergic reaction to medications like antibiotics, you will now be eligible to receive your COVID-19 vaccination. Secondly, women who are pregnant may receive vaccination after they discuss and receive endorsement from their obstetrician, and this applies irrespective of the stage of pregnancy. Also, if a woman had become pregnant after receiving her first vaccine dose, she may proceed with her second vaccination after discussion with her obstetrician. Women who are breastfeeding are eligible for vaccination. They can continue to breastfeed their baby throughout the period for first and second dose vaccinations, and there's no need to stop breastfeeding. For patients with active cancer and are undergoing chemotherapy, immunotherapy, or radiation therapy presently or recently in the past 3 months, we had previously exercised considerable caution and advised that they complete their treatment before getting vaccinated. We have since reviewed the data and experience in other countries and will now allow them to get vaccinated after they are assessed by their treating doctors on their suitability for vaccination. At this time, we prefer for these patients to be vaccinated in a hospital setting where they can be better monitored for their health status. And we will review later whether these conditions can be revised. Patients who are soon to start chemotherapy, immunotherapy, or radiation therapy in the next 2 months should similarly consult their oncologist for their suitability for vaccination. But patients with a past history of cancer and who are no longer on active treatment can apply for vaccination in any of our vaccination centers. We hope that these adjustments to our guidance will offer vaccination opportunities for more people and allow them to benefit from the enhanced immune protection that vaccination offers, as we see more cases arising in the community and with the emergence of more cases due to viral variants of concern. At our last media conference, we had announced that the Health Sciences Authority had extended the authorization of the Pfizer-BioNTech COVID-19 vaccine for use in adolescents between the age of 12 and 16 years. The vaccination regime for these within this age group is the same as that for adults. The approval under HSA's PSAR approval framework has also been endorsed by MOH's Expert Committee on COVID-19 vaccination, which also looked very closely at the data for safety and efficacy of the vaccine. The data available for review was very similar to that submitted to other regulatory authorities in the US and other countries, and was based on the ongoing phase 3 studies that involved nearly 2,300 adolescents between the ages of 12 and 16 years of age. And there was a very high vaccine efficacy shown in the vaccinated group, with no COVID-19 infections being reported in this group compared to 16 cases of infection in the unvaccinated control group. And this is a result that was consistent with the results reported in the adult vaccinated population. As in adults, vaccination offers a good protection for children of 12 to 16 years of age, protecting them from getting infected, but may not prevent all infections. But the data provides great confidence that those who are vaccinated will be protected from getting severe infections. Vaccinating children also carries the secondary benefit of reducing the risk that others within the same household will be exposed and infected with COVID-19 infection. The safety analysis from the study also showed that within the period of follow-up, which was at least 2 months for many of the adolescents in the study, adverse effects were not common and were generally mild. In fact, the safety profile was very similar to other vaccines that are normally offered to children. Children generally have a stronger immune system compared to adults, and they may experience a slightly higher incidence of minor effects like fever, injection site pain, tiredness, and headaches compared to adults. And this is a common phenomenon for children from all types of vaccines that they receive, not just the Pfizer vaccine. These reactions will resolve within an average of 1 to 2 days. In fact, these reactions demonstrate that the immune system is functioning well and responding to the vaccines. There have been very isolated reports of adolescents with a known history of depression who reported their symptoms worsening after their vaccination, but there is insufficient data to assess whether this is due to the vaccine or not. Nonetheless, we recommend that children with a history of depression or anxiety should first be assessed by their doctors and assured that their condition is stable and under control before they go for vaccination. There have been isolated reports of myocarditis being reported following COVID-19 vaccination. Myocarditis is a condition characterized by an inflammation of the heart muscles. It's been reported in patients who have had COVID-19 infection, not just vaccination, and it can occur due to a variety of causes unrelated to COVID-19 infection or vaccination. And so far, the number of cases reported does not appear to be more common than what is generally present in the unvaccinated children population. We are monitoring this trend closely and will see if our vaccination strategies need to be adjusted over time as more data emerges. But at this time, based on the overwhelming assessed benefit of vaccination over the risks that have been reported, HSA, the Expert Committee on COVID-19 Vaccinations, and MOH remain confident that the COVID-19 vaccination can be offered to our children between the ages of 12 and 16 years. This is the same position adopted by other countries like the US. In fact, in the US, since approval had been granted by the FDA, there have been more than 6 million adolescents vaccinated between the ages of 12 and 18 years. So we'll be watching very closely the experience of others in the US, in Israel, and it will guide our policy even as we start our own program to offer vaccination to our school children. Thank you.
Chun Sing, over to you.
Good afternoon, everyone. The well-being of our students and educators are foremost to the confidence of our parents in our school. MOE's intention is to have as many of our eligible students vaccinated as soon as possible when vaccines are available. To achieve this, we will organize the vaccination program for more than 400,000 students with the following considerations. First, we will leverage on the network of community vaccination centers across the island for ease of booking during the June holidays. Second, we will have 4 additional vaccination centers by the 7th of June, 3 of them in our ITEs, and 1 additional one at Raffles Convention Center, kindly offered to us by MOH, to provide greater assurance to our students for the access to the vaccines. These 4 additional vaccine centers are geographically spread out across the island to provide added convenience to our students and parents. Third, for students who require greater support and are unable to get vaccinated through their parents' booking, our schools will arrange for them to get vaccinated when school reopens. We will commence the invitation to vaccinate with the graduating cohorts of O, N, and A-level students tomorrow, 1st of June, with the earliest slots available from the 3rd of June. We will also work with MOH and our SPED schools to facilitate the vaccination of our SPED school students in situ, so there's no need for them to go to the vaccination center. Separately, as the 3 dedicated MOE vaccination centers are located on the ITE campuses, ITE will also make arrangement for their students to take their vaccinations on campus. The rest of the eligible school cohorts, polytechnic students and autonomous university students, will be progressively invited to make their bookings in the coming days. All medically eligible individuals are encouraged to consider getting vaccinated when the vaccination is offered to them. And we'd like to thank all parents for working closely with our educators and schools to keep our children safe. Now let me say a couple of words in Mandarin. 大家好，教育部希望与家长一起合作，让符合医疗条件的学生早日接种疫苗，以达到我们所谓的3个安：第一，师生安康；第二，学校安全；第三，家长安心。首批 N、O 和 A 水准的考生的家长将从明天开始陆续的接到短讯，邀请他们为他们的孩子预约，就是以最快从6月3号开始可以接种。其他的学生与家长将陆续的得到通知。我们希望在6月假期中，在疫苗供应情况允许下，为最多可能接种的学生尽快接种疫苗。接下来，卫生部与教育部也会通过网络座谈会，为有需要的家长分享更多讯息和解答他们的疑问。我们非常感谢大家的紧密合作与配合，让我们的学生能早日接种。谢谢大家。
Good evening. As you can see from the daily cases so far, our measures are working and bearing fruit. But we are not out of the woods yet. If all goes well, we should be able to bring down community cases over time and break the transmission chain. But meanwhile, there are still unlinked cases popping up every day. And any one such case can easily be a super spreader and cause a major outbreak to happen. I go back to the metaphor that we had used last year of a fire. We are taking steps to contain the fire and to minimize its spread. But the embers of the fire are still out there, and they can easily spark another major flare-up. So the situation is highly fluid, and our assessments are being updated on a daily basis. As much as there is a chance of us relaxing some of the measures after 13th of June, if things continue to improve, we must also be mentally prepared that we cannot rule out the possibility of further restrictions down the road if they become necessary. For example, from the recent cases, we are now studying if there is any common pattern of activity or movement that might suggest new areas of risk to watch out for and which would require additional precautions or safeguards. At the same time, if there are specific venues where we find people gathering or consistent breaches of safe management measures, then we will have to take actions to close these venues. So that's the overall posture we will be taking over the coming weeks, in addition to all the steps that have been highlighted just now, which is to ramp up testing, speed up comprehensive contact tracing, and scale up our national vaccination program. Meanwhile, I want to thank everyone in Singapore for doing your part to help curb the spread of the virus. All of you have demonstrated tremendous discipline and social responsibility over the past 2 to 3 weeks. So thank you very much for this tremendous response. We've done well so far, but this is not the time to relax or to let our guard down. In fact, it is absolutely critical that we continue to stay home and to work from home wherever possible, go out only for essential activities, and minimize our daily contacts. If you feel unwell, see a doctor immediately. If we all continue to do that, then we will be able to bring down community cases further and bring this current outbreak under control. Thank you very much.
Thank you. And now I invite questions from the media.
Thank you, Ministers and DMS. The time is now 5:01 p.m. We have until 5:30 p.m. for the question and answer session. Could we have the first question from ST? Salma, please.
Thank you, Ministers, DMS. Children remain less severely affected by COVID-19 than most adults should they get infected. So it seems rather unfair to give them priority over people who are in their 20s and 30s, possibly with the exception of students doing the national level exams this year. In fact, if anything, I would say domestic workers looking after the frail elderly should be given priority because they go out and do the marketing, they come back, and they possibly could bring the buck back to people who are at the greatest risk.
Okay, there are too many ministers that can answer that question. So I'll go first. I think, Selma, your points are well taken. On the other hand, students also live amongst households and often three-generation families too. They can also come into contact with the elderly, and they also go to schools. They do mix around with other students. And for the older students in IHLs, they also have a campus life. So I think, given the new strain that we are facing and the priorities that we are, then the fact that we have gone out to vaccinate the most vulnerable groups, plus the front line, which is most exposed to the virus. I think for the rest, in terms of public health, and I think DMS can elaborate on that, in terms of public health, I think the differentiation are no longer so big. And so for students, given school life, given their proximity to household members, including the elderly, we felt that it is appropriate to start our next phase of exercise prioritizing students. And in any case, I think we are looking at beginning of June to around middle of June, when we extend to the next group of young adults.
Thank you, Minister. Could we have the next question from Taobao? Ke Yang, please.
Thank you, Ministers and DMS. Ke Yang from Zaobao here. If we count Yishun Block 745, which will start testing tomorrow, there are 3 blocks of flats with all residents tested since this new wave of infection hit us. Would there any indication of within block transmission for the first 2 blocks? Under what circumstances do we mandate all residents from the whole block to be tested? And is this what we anticipate as a new normal? Thank you.
DMS?
Thank you very much for the question. With each case that occurs in the domestic setting, and when we start picking up clusters, we do look to see whether there are obvious chains of transmission, modes of transmission that are of concern. And when we pick up several cases that occur within a fixed geographic vicinity, then we have to be concerned that there may be also chains of transmission that occur to other people that live in that same area. And this is the reason why we would then extend and carry out testing operations, in this case in a housing precinct involving several blocks of flats. We reinforce our testing by looking at other data as well. As has previously been explained, we do look at various other testing modalities, including wastewater testing. And where wastewater testing shows signals that may suggest still shedding of virus that comes out in the wastewater, it raises concerns that we may still be seeing some additional people who may be asymptomatic but carrying the virus infected and potentially infectious to others. And this creates an urgency for us to launch these testing operations, including the example you have mentioned earlier. So we look at each cluster on a case-by-case basis, looking at the circumstances and making that decision whether we want to organize these testing operations. They're not easy to do, but it's important for us to do this aggressively in order to get ahead of the curve and to try and make sure we get control to prevent further infection occurring to others in the community.
Thank you, DMS. Could we take the next question from CNA? Su Hui, please.
This is Su Hui from CNA. I just wanted to ask about updates to the vaccination program, especially on the special access route. There will be open access to other vaccines. Do we know which vaccines are on it, and how would this move allowing other vaccines actually affect the national vaccination exercise?
Thank you, Su Hui. As I mentioned earlier, the special access route is an existing avenue. And what we are taking reference on is the WHO emergency use list. Yeah, so if a vaccine is approved by WHO to be in the EUL, we will allow a private healthcare provider to apply to MOH and bring in that vaccine to be given to individuals in our population. And right now, there are only a handful of vaccines in the WHO EUL, as I mentioned earlier, is Pfizer-BioNTech, Moderna, the two which we are using for our national vaccination program. In addition, there is J&J, Johnson & Johnson, Sinopharm, and then AstraZeneca. Yeah. So, of course, there are many other applications before WHO now, one of which is the Sinovac vaccine. If WHO approves the Sinovac vaccine into the EUL, then a healthcare provider can apply to have access to use the 200,000 doses that we have and then use it to administer to individuals in our population who wants to have it. Having said that, I was mentioning earlier that a large part of that group that wants alternate vaccine is because thus far, because of their history of anaphylaxis, they were restricted from taking the two national vaccination vaccines. Yeah, but the expert committee is reviewing our current position. They need another 2 weeks or so to come to a new position with a view to allow many in this group to have access to our current two national program vaccines, Pfizer-BioNTech as well as Moderna. So I hope this move in the coming 2 weeks will largely address the current concern.
Just to extend on the Minister's comments, the Ministry of Health as well as the expert committees continue to look out for other promising vaccines that we may also bring into Singapore. Our approach is to provide a portfolio of different vaccines that meet our needs, and we do understand that there are individuals who are not able to receive the mRNA vaccine even with a relaxation of rules. And we look towards procuring some of these vaccines that then can also receive HSA's PISA approval. So we hope to present more alternatives to the population that allows a greater confidence in being able to take on vaccination and to allow them to be protected.
Thank you, Minister and DMS. Could we get the next question from Channel 8? Tseng Yi, please.
You are muted.
Sorry. Hi, Ministers and DMS. This is Zheng Yi from Channel 8 News. We would like to clarify, currently priority is given to students sitting for N, O, or A-level exams. So what about PSLE students? Thank you.
Zheng Yi, thank you for your question. The PSLE students will be notified together with the SEC 1, 2, and 3 batch when we next rolled out the program. But I must explain that we go by age. So only the students in P6 who are 12 years old and older will be eligible to take the Pfizer vaccine.
Thank you, Minister. Could we get the next question from BBC? Nicholas, please.
Hello, everyone. It's very likely we're going to see a scenario, even possibly this year, where Singapore is fully vaccinated, where almost everyone has a very high level of protection from the virus. But Singapore's neighbours, countries here in the region, are still way behind. My question is, will Singapore have to wait for everybody else in the region to catch up with their vaccination programs before opening up? Or will Singaporeans be allowed to travel freely in any case, knowing that they're very well protected?
Well, we have always taken a risk-based approach towards this. So if you look at our border measures, we already differentiate countries by risk and based on the infection levels in these countries. So if a country is safe, we already allow Singaporeans to go there and come back without any quarantine in Singapore. And we even allow travelers from these places to come to Singapore without quarantine. On the other hand, if a country is not so safe, there are high incidence rates that's prevalent in these places, then we have tighter border control measures where a traveler coming in will have to serve a quarantine in a dedicated facility. So we will continue with that approach in the coming months. And if as we monitor the situation, if more countries become safe, infection rates come down, vaccination rates are high, then potentially we will be able to open up more with these places. On the other hand, if there are places where the incidence rates will remain high and there are concerns, there are high-risk areas, then the border measures will remain and the quarantine measures will remain.
Can I just add to that? I think our desire is probably similar to yours, which is that if we are well vaccinated, if Singapore is safe, individually we are quite well protected, of course we hope Singaporeans can gain the freedom to travel, especially business travel, going overseas, visit your relatives that are living overseas or family members living overseas, or look after the investments that's been overseas, and then be able to return without serving 21 days SHN, which basically you forget it, nobody will travel that way. So of course we hope to resume that normalcy, but I think the truth is we don't have enough data to decide whether lifting all those restrictions is possible as of now. But certainly we are heading in the right direction. If we can get ourselves substantially vaccinated, protected, certainly travel restrictions will have to be reviewed with a view to restore our ability to travel and become a business hub.
Thank you, Ministers. Could we get the next question from Reuters? Chen Lin, please.
Good evening, Ministers. So on allowing private sector to supply COVID-19 vaccines, does that mean that non-residents such as tourists will be able to get a COVID-19 vaccine in Singapore? And is there any pricing guideline for the COVID-19 vaccinations via the private clinics? Thank you.
Thank you. For the first question, our priority now is still to vaccinate our own population. Yeah, so it's still for residents. Even for the SAR route, it's primarily targeted at residents. Second, in terms of pricing, you are right, because it becomes a private initiative under the SAR route. Pricing will have to be determined by the private healthcare provider that apply to MOH.
Thank you, Minister. Could we have the next question from Rita Harian? Atia, please.
Hi, Ministers. I would just like to get your opinion on what are the risks in having the ART testing kits over the counter. Because, you might have individuals who already test themselves and probably they do not want to go back to the doctor for a second check or things like that. I mean, what could be the risk for such? I mean, they are really good, but what can be the risk for this? Thank you.
Thank you very much for your question. We are actually working out a set of instructions and guidance that will accompany these test kits once they're made available in the pharmacies, for example. And they will explain not just how the test is to be done, how to perform a swab for the purpose of administering the test, but also the circumstances where the test is appropriate. So, for example, if you are sick, you actually have symptoms, you should actually see a doctor, get that properly assessed, and get the best test done to diagnose or exclude the presence of a COVID-19 infection. And the antigen rapid test would not be appropriate for either making that diagnosis or excluding in that particular setting. If you are asymptomatic, and this was done really for screening purposes, as Minister had mentioned previously, then the antigen rapid test may be suitable. However, you need to be careful about how you interpret these tests, because they are not as accurate as PCR tests, and therefore a positive test on an antigen rapid test kit needs to be confirmed, and we still recommend that you see a doctor for a proper confirmatory test to be done. If it were negative, we would recommend that you not be complacent, and you should still adopt the precautions, including mask wearing, hand hygiene, infection control, safe distancing, which would then protect you, because you never know whether you're still in an incubation period, and the following day you might actually become infected and turn positive. And it's important to appreciate and interpret the results in the correct setting. So these sort of FAQs will be provided when these test kits are purchased, and we will provide relevant additional information on our website so as to better educate the public and for them to be able to understand how to use these kits and how to understand the significance of these the test results.
Let me just add a few words. I think the use case is important. I mentioned earlier that we are rolling out many pilots, and the pilots really is to nail down the use case and the settings. So take, for example, self-test ART. Really, we need to find the use case. And it could be, say, an employer, could be SPH or MediaCorp, and you hire journalists who are frontline workers who meet many people. And therefore, you may have a protocol for the company and the employer to say, all my employees, every week, you can purchase a self-test kit, test yourself, just to make sure that you are safe. So it becomes part and parcel of a surveillance program under a controlled use case, facilitated by employer, for example. So the pilots that we are rolling out in the coming days are very important to really nail down the proper use of each of these kits.
Thank you, Minister and DMS. Could we have the next question from today? Janice, please.
Good evening. Thanks for taking my question. On the new requirement for those who are household members of close contact to be placed under quarantine, I just want to ask whether how are authorities going to enforce this? Will it be left to individuals to self-manage? Because you all mentioned self-isolate, right? Or, basically how will authorities make sure that people actually abide by this new requirement? Thank you.
Thank you very much for the question. We're working through all the processes. The intent really is to make sure we get ahead of the game. We understand that when close contacts spend quite a considerable amount of time with a person who eventually is found to be positive, there's a very high chance that these contacts can be positive. And in order to be able to get ahead of the game, then we ask that these household members also self-isolate as a precaution until we can clear the contacts and be assured that these contacts are also not themselves infected. We will do this in a variety of ways. Once we get information in terms of who the household members are, we may send SMSs, contact these household members ourselves to inform them that they are identified as contacts of contacts and they should isolate. We may follow through subsequently with quarantine orders for this purpose. And only when we clear the contacts from being infected, then we rescind the orders and allow household members then to come out. At this point in time, the thinking is that they can isolate at home, but it would also depend on the household situation to determine whether it is feasible and possible to self-isolate at home. We ask the public to cooperate with us. This is done with the best of intent to make sure that we control infection quickly, decisively, and it's not intended as a means of trying to stifle the freedom of household members to move around. And this is really for the benefit of all others in the community.
If I may just add a few words. Remember, these are the second-order contacts. They are not the close contacts. They are the household members of these close contacts, second order. But we have found from experience that because the new variant strain is so infectious, that it tends to circulate very quickly amongst household members. And that's why as an additional precaution, we are now asking all household members of close contacts, when your household member is put under quarantine, we will notify you immediately to stay at home, just as an additional precaution until we confirm the test result of the person under quarantine. We again call on everyone, just cooperate with this simple, but I think it will be a highly effective measure because it will ensure that if you are already infected but you may not know because it's still incubating, or you may not have symptoms, but by staying at home you can ensure that the virus does not go out, it does not spread to more people. So it's a precaution that we are putting in place, it's an additional measure. We think it will help, and we seek everyone's cooperation to comply with the rules.
Let me just come in with one more sentence, which is a data point that I mentioned just now. Today, of all the linked cases, 70% are household transmission. So I think this is a worthwhile measure to take.
Thank you, Ministers and DMS. We will now take the last question from Tamil Murasu. Indu, please.
Yes, with this new label of endemic, we understand that this virus is expected to be around for a while. Given that the new variant spreads faster, is there a possibility that we may see another spike? And how fast should the number of cases fall before measures are relaxed? And are there any traces of the new variant from Vietnam?
We will continue to monitor the situation. As I've highlighted just now, it's very fluid. If all goes well, we already see the reproduction number of this virus in this latest outbreak coming below 1, which means that day to day, week by week, there will be a chance of cases coming down further. And we will continue to monitor unlinked cases, cryptic, whether or not there's a sense from our surveillance of the extent of community spread. And if all goes to plan, there may be a chance, as we have highlighted on 13th of June, for some adjustment and relaxation of measures. It's very unlikely on 13th of June that we will go all the way back to phase 3. We will have to do this gradually and in a controlled manner. So there is some chance of relaxation, but in a controlled and calibrated manner. On the other hand, if we monitor over time and there is a risk of, or we see new risk emerging new clusters emerging, more unlinked cases which we are not able to track down and pin down, then it may suggest that this is continuing a little bit more than we are comfortable with, and therefore we may have to take additional restrictions or precautions and safeguards based on the data. So it's really, we are updating our assessments on a day-to-day basis, and we are continuing to monitor this very carefully, recognizing that this new strain is highly infectious, and we have to continue to do everything we can to bring down the latest cluster, the latest outbreak.
You asked also about the recent report about a new viral variant of interest being identified in Vietnam. To put this into perspective, this was what the Vietnam's National Institute of Hygiene and Epidemiology had discovered when they were testing 4 cases in Vietnam. And they described a particular deletion of a particular gene that codes for a particular part of the spike protein on the B16172 variant, which was also reported previously in the B117 variant. They have not, as yet, up to the weekend, registered this information with the global registry that we use to track all these emerging viral variants. So until it's actually registered with GSIDE, we don't have enough information to tell what kind of specific variant of interest this is. I should point out that even in the B16172 variant, there are in fact sub-variants that exist, because the virus does continue to evolve, and some mutations may continue to take place. And there have been previously described some local mutations that in fact are also seen within the B117 variant. WHO has asked us to ask all countries to exercise caution in interpreting these results, because at this time the presence of such a deletion is not known to be associated with any increased virulence, increased transmissibility, increased infectivity. So we wait more information before we can actually tell whether this particular viral variant would become a variant of concern. Until we get formal information through the global registry, we won't be able to tell whether this particular variant is also seen in any of our cases, but we've not seen any particular deletion in the same area which was described by the Vietnamese. We'll wait for further information before we can be absolutely certain.
Let me just wrap up very quickly. We are 2 weeks into the phase 2 of a heightened alert. Next few months are very critical. And as we plan and move forward and hope that we can slowly open up, and it is very important to bear in mind that it's not just depending on the number of cases. And Minister Wong has mentioned that you also have to look at whether they're linked or unlinked. But beyond that, it is also important for us to look at our capability and capacity of testing and contact tracing, as well as the level of vaccination. As we mentioned, as PM highlighted, these 3 are very critical for us to push ahead faster and do a lot more. And if we are able to do that, raise the vaccination levels significantly, test much faster, quarantine much faster, and able to contact trace very quickly, then this will give us more capacity to open up gradually and safely. So we have to continue to remain vigilant and continue to exercise caution and observe the safe distancing measures, and this will allow us to move gradually towards opening again. Thank you very much for being with us this afternoon.